Welcome to the Holistic Oral Health Summit. I'm your host, Jonathan Landsman. Did you know that 80% of disease symptoms are related to problems in the mouth? As a health and fitness consultant for nearly 30 years, I believe this is one of the most overlooked problems within conventional and integrative medicine. That's why I created this summit to help you identify, prevent, and eliminate the roots of disease. Our show today, Dangerous Dentistry, a medical perspective. Our guest, Dr. David Minkoff, graduated from the University of Wisconsin Medical School in 1974 and worked for more than 20 years in the conventional medical world. In 1997, he and his wife, Sue, founded LifeWorks Wellness Center, now one of this country's foremost alternative health clinics. In 2000, he founded Body Health, a nutrition company, which offers a unique range of dietary supplements to the public and practitioners. Today, I asked Dr. Minkoff to give us his very best professional experience about what he's seen to be the most dangerous misconceptions and practices of conventional dentistry. We'll start by asking Dr. Minkoff a very personal question about his wife and how that forever changed the way he looks at dental practices and its impact on human health. We'll also talk about the misconceptions and dangers linked to root canal-treated teeth, electrogalvanism, how poor oral health can increase your risk of a heart attack, and even cancer, plus much more I'm sure you'll see that we get into. By now, I hope you understand the main reason why I created the Holistic Oral Health Summit was to give you the tools and knowledge necessary to make a fully informed decision about your health. And today, I'm sure you'll learn a lot, so let's get started. Please join me in welcoming Dr. David Minkoff. Dr. Minkoff, welcome.
Thank you, Jonathan. Great to be here again.
It's great to have you part of the event. Dr. Minkoff, let's start off, as I said before, I heard you got into integrative medicine because of your wife who had a dental issue. Please talk about it.
Well, my wife's an RN. She was always health conscious. She's a triathlete, and she had a lot of amalgams as a teenager, but pre-teenager. And all of her major molars had amalgam, silver amalgam fillings, mercury fillings, and she didn't like the way they looked, and she started reading things about how it was dangerous, that the amalgams could off-gas into your system, and they could make you sick. And so she decided she was going to be active about it and went to a dentist who wasn't really trained in removing amalgams properly. And shortly after that, she started to get sick. I was an emergency room doctor at the time. I thought she was crazy for trying to take her amalgams out. Seemed like they were there, they were fine, they didn't hurt, and why don't you leave well enough alone? But after she did it, she came down with a number of symptoms, and one of the most prominent symptoms was that she woke up one morning with a weakness of her shoulder muscle. She couldn't brush her teeth right, and her glute muscle, her buttock muscle on one side was also weak. And this really concerned me, and I was in the emergency room, and I knew all the best doctors in town, and I sent her to a bunch of them to find out what was wrong with her. And they weren't really sure. They said it looks like some kind of autoimmune condition, and it could be MS, and they didn't really know. And their suggestion for treatment was how everybody treats autoimmune disease anyway, which is you use steroids, and for MS, interferon. And that just sounded crazy to me, and I didn't know what to do. I didn't know anything about toxicology, really. And I, by accident, met a biological dentist who had just moved into the complex where she was working. She has a home healthcare nursing business, and this guy had moved in, and on the marquee it said natural dentistry. And one day he was walking out to his car, and I stopped him and said, introduced myself and said, here's the story. Do you think this is related to the dental work that she had done? And without any lapse at all, he said, oh yeah, she's mercury toxic. That when he drilled those fillings, they aerosolized. Mercury at room temperature is a liquid, and it boils at 110 degrees. And when you take a high-speed drill and you drill it, you aerosolize it, and it turns it into very tiny particles that go all over the mouth. It's swallowed. It goes into the palate. It's taken up by nerves in the palate. It goes into the brain. And mercury at very, very, very small concentrations is toxic to nerve cells. And so he said, that's what's wrong with her, but there's nobody in this town that's going to help you with it. You should go to Seattle. There's a doctor there who trains doctors in diagnosing and treating these kinds of conditions in a natural way. So I jumped on a plane. I went out there, spent some time learning how to do this, how to test for it, and how to do it. And when I came back and we tested her, she indeed was mercury toxic. Her blood levels of mercury were high. We did the treatment suggested. Within a couple of months, all her symptoms went away. That was 1996. We're now 21 years later. She's still a triathlete. She regularly places in her age group, and she's completely fine. And that really woke me up that, holy cow, I could take care of someone with a broken hip or a heart attack or, some acute medical emergency. I was really good at that. But this whole area of toxicology and environmental stress on the body, I didn't know anything about. Now, she was always going to meetings, and she said one day, hey, there's a guy that's coming who really is smart. His name was Jeff Bland. Why don't you go hear him? And I went to see Jeff Bland, and he sort of converted me. It's like, holy cow, there is a nutritional approach to illness that can really work. And so in her nursing agency, there was an extra room, and I decided I would set up a little office there and just play. I would try this stuff on other people to see if it worked. I was working in the emergency room, so it's shift work. It was, 12-hour shifts, 3 or 4 days a week. I had some time. And our friends saw what happened to her, and they would come, look, I've got migraine headaches. I've got arthritis. I've got IBS. I'm fatigued. And I just sort of started learning how you could help people. And what was interesting is that many of the conditions that were the most serious chronic illnesses in people had to do with problems in their mouth. And that if you didn't solve the problems in their mouth, they wouldn't get better. So that's kind of what got me into it and got me very interested in dentistry and what are dentists doing. Some of it is fine, but a lot of it is not fine.
Dr. Minkoff, I certainly can relate to a lot of what you were saying. For those who specifically want to dive a lot deeper, and, you talk about a wake-up call, when it comes to the mercury in particular, please get a chance right here on the Holistic Oral Health Summit to listen to Dr. Boyd Haley talk all about mercury toxicity, and also Dr. Chris Shade. Super important that you tune into those programs in particular, and also in terms of a whole process to get mercury-based silver fillings extracted out of the mouth properly. Make sure you check out Dr. Leonard Fazio. He happens to be my own personal dentist as well, but we go step by step in great detail as to how to protect yourself, and also how staff in a dental office and a dentist themselves, how they can protect themselves as well. So it's a very good conversation to listen to. Dr. Minkoff, I'm just curious as I'm listening to you speak, dentists, a lot of healthcare providers, I feel, don't consider the mouth in certain respects to be a part of the rest of the body, meaning how it's so related, like you just said, to the health of the rest of the body. What do you think is going on here?
I don't know. I think it's a function of their training. Some things dentists do take seriously and realize it's a problem, like gum disease. Gum disease is definitely known by mainstream dentistry as a problem. If you have deep pockets, they're infected. They can relate to cardiovascular disease and other things. In that area, they do fine. In the area of materials to put into fillings, they don't do so fine. And I think it's a function of education. I think that there are big interests between manufacturers of silver amalgams and dental associations, and they look the other way, or they don't look seriously. Lots of experiments have been done with animals and putting mercury fillings in and then checking the animals 3 months later, and you find the mercury in their kidneys and in their hearts and in their livers and in their brains. There's no question that this stuff gets around and is very bad stuff. So I don't know, but it's very strong in dentistry, and probably the worst area, well, mercury's one area, but the other area that it's really bad is in the whole root canal area, because there is no place in medicine where anyone would leave in a dead, infected organ. A root canal tooth is a dead, tooth, it's infected, and a surgeon would never leave in a gangrenous appendix or a gangrenous toe. Dead tissue has to be removed because it putrefies and it sets up an area for infection. But in root canal treatments, it's 20 to 30 million a year. They just think, well, it's just fine. We're leaving the dead organ in, and there's nothing to worry about.
Dr. Minkoff, let's get into that a little bit more, because I think people who are new to this information are really going to be shocked about it. And I can tell you from a personal experience, Dr. Minkoff, I'm sure I'm not telling you something you're going to be surprised. My wife had root canal treated teeth, 3 of them that were taken out, right? And 2 of them, you could see the body was trying to protect itself, when looking at x-rays. Oh, it looks like a little grayed area. It was trying to wall off the infections. Yes, it's good to get those teeth out. But what was most interesting to me is the 3rd one, which she absolutely wanted to take out of her mouth. She just didn't want it in there, showed nothing at all. Yet every single one of those teeth that were root canal treated, when they actually took it out of the mouth, you're talking about the pus, you're talking about the infection. It was there. You could see it at the bottom of that tooth when they pulled it out. Just incredible. And what a sense of relief to get that out of the mouth. You know what I mean? An infection like that. But before we get too off, I'd like you to kind of cover the standard of care of a quote-unquote good root canal treated tooth. Why don't you talk about that first to get people grounded?
Sure. The reason a root canal is done is because the tooth has become infected. And in an attempt to handle the infection, a tooth is bone. So its anatomy is like bone. There are little canals, they're called dentin tubules, that are the pathway for the artery and vein within the tooth to get nutrients to the edge of the tooth and to get the waste products from the cells back into the circulation so that they can be cleaned out. And what you see if you look at root canal teeth that are pulled and you do very high-powered microscope pictures, what you find is that those dentin tubules are full of bacteria. And they're not nice, friendly bacteria that might reside in your gut. They're very pathogenic bacteria which produce biotoxins, very potent biotoxins. And they leak into the body through the root of the tooth. Now, since during the root canal procedure the artery and vein are taken out, there's no way for the body's immune system to get at the infection. So here you have a dead tooth, it's infected, there's no blood supply, and so the body can't combat it. And these pathogenic organisms put these toxins into the jawbone, which is 2 or 3 inches from the brain. The main nerve root from the brain to the teeth is the biggest nerve root in the body. There's no relay point. That 5th nerve goes straight from the jawbone right into the midbrain. And so for the body, it's a huge threat, because if those toxins go along that nerve into the brain, then you're going to get a brain infection, and that's very serious. So the body mounts a big immune response in the area to try to wall the area off. And as you said, you see these black areas around the edge of the tooth, and those are actually abscesses. And dentists don't usually do this, but if you pull a root canal tooth and then you take a scraping of the jawbone at the base of the tooth and do a culture on it, what you'll find is chronic bone infection with very bad organisms. And it's just a procedure that is, I think they get away with it because nobody has looked at the long-term health consequences of, okay, here's 1,000 people who had root canal teeth. Now let's follow them for 5 years, 10 years, 15 years, and see what diseases they come down with that might be related to the toxins in their mouth. Nobody is looking at this. For an endodontist, which are the guys that usually do root canals, although a lot of general dentists do it, the standard of care is the tooth looks good, it doesn't hurt, and that's enough. And if you do an x-ray and you see an abscess, well, it's asymptomatic, so we're just going to live with it. One of the things I've learned in the last few years is that standard x-rays to see if the root canal is okay are not any good, that you need to get what's called a cone beam CT. This is a CT scan of the teeth, and only about 5% of dentists have this equipment. But if you start sending, every patient that I see that's got a root canal, I send to the dentist near me that's got one of these. I write a prescription. I say cone beam CT, rule out abscess. 99% of the patients that come back with the report says root canal, tooth 4 and 17, abscesses present in both. It's almost always that there's a problem there.
Dr. Minkoff, this is really powerful information. I want people to really get this, and probably for another minute or so, I can guess what your answer is going to be, but I think it's still important to address why dentists and doctors don't look at this more critically. And what I'm talking about is specifically the root canal treated teeth, and that there's a problem. I mean, I think part of it certainly has to do with the fact that they're not trained this way in medical school, but I think a lot also, and I want to get your feedback on this, is that even what you just said, which is powerful information, what I've experienced in my own life, watching my wife get these teeth extracted, they're all infected, doing almost 500 programs in 5 years and talking to so many integrative doctors who have seen that people get the root canal treated teeth taken out, and they literally are reversing out symptoms of autoimmune disease and cancer and all kinds of different symptoms that cause all kinds of problems. Listening to Dr. Hal Huggins over the years before he passed away and doing programs with him, it was absolutely outstanding information. But again, I think a lot of medical doctors, and you're certainly part of that group, right? They would sort of roll their eyes and say, okay, fine, I know you've seen a lot of people, but where's the scientific studies? Do you think this is why they're still not looking at this closely? It's the way their brain works? I don't know.
Well, there are studies, but they're buried. I saw a study in Circulation. Now, this is the Journal of the American College of Cardiology. And the article, what they did is they took people who had fatal heart attacks. So they had a blood clot in their coronary artery, which they died from. And they took those group of people that had root canal teeth, and they did what's called PCR testing on the clot, which is a way to identify the DNA of a microorganism using this sophisticated technology. And so what they did is they did the PCR test on the clot, which identified microorganisms in the clot, in the heart, that killed the guy or gal. Then they pulled the root canal teeth. This is post-mortem. This is after these people have died. And they did the PCR testing on the residue, on the exudate from the teeth. And there was a 75% match of the bacterial load from the teeth that were in the heart clot that killed the guy. There is loads of evidence on this. It isn't unknown. It's just ignored.
Dr. Minkoff, what you just said right there reminded me, Dr. Thomas Levy is a board-certified cardiologist. He's a part of the Holistic Oral Health Summit. He goes really all the way by warning people in terms of a heart attack that he's saying 90% of them are actually triggered by these root canal treated teeth. I mean, it's a multitude of reasons, right? It's not just, say, one certain bacteria gets into the heart, like that kind of thing, but it's the point of the toxins spilling into the body constantly, injuring the cardiovascular system, causing chronic inflammation, and on it goes, right? Then cholesterol rushes to the area to try to rescue the heart tissue and the plumbing, the circulation as well. So there's so many different factors here, but he says it's just so extremely toxic, a supply of just real pure poison that you want to avoid by really taking care of getting these teeth out of your mouth.
Yeah, and Dr. Boyd Haley, who's on this summit, had actually set up a laboratory at the University of Kentucky some years ago where we could actually test the root canal teeth. And we took this kind of stiff cotton pledget, and we would stick it underneath the gum where the root canal tooth was. You pushed the thing up into the root, and you pulled it back, and that little pledget would absorb some of the liquid stuff that was coming out of the bottom of the root canal tooth. And you'd label that specimen A. And then you'd take a healthy tooth on the other side of the mouth and you would do the same thing. So you had a control in the same person's mouth. And we would send it to that laboratory, and they would do bioassays on the toxins that were coming out of the tooth. And what they did is they set up the assays to see how much inhibition, how much block of the what are called the Krebs cycle enzymes. These are the key enzymes in every cell which allow the cell to make energy. And if cells can't make energy, they get sick and they can die, but they get sick and they don't function right. And in people who have chronic illness, usually that system is not working. And what we would find in case after case after case is that the root canal tooth would have 90-95% blockage of these 6 key enzymes which the cell depended on to make energy. And on the healthy tooth, there'd be almost none. So there's no question, this is documented material. I know that when he did this research, he was trying to get it published in dental literature, and nobody would do it. And it ended up in the chemistry literature, which nobody reads that's in clinical practice. So this is not unknown. It is known. It's just ignored.
Yeah, Dr. Minkoff, I really, it comes back to what you just said at the end there. I absolutely am so glad that you repeated again. That's what I've seen in like 30 years of practice here in the health and fitness profession, that we mention these things and it absolutely is either overlooked, blown off as not that important, or just completely ignored, worrying about people's own agendas, financially, politically. This is what it is. Yet this information is still getting out. I encourage everybody to take this kind of a conversation and share it with someone you know, a family, a friend. Get this out to people because there are doctors that are waking up. There is help for you. Dr. Minkoff, let's get into another area that's really important, electrogalvanism. Another thing that's sort of the American Dental Association, they just sort of like to keep quiet and completely ignore. Why is this a problem for a person's health?
Well, electrogalvanism is, what happens is if you take 2 separate metals and you put them in a salt solution, the electrons from one of the metals will travel to the other one depending on the characteristics of the metal. And that's how a battery works. If you take your car battery and you open it up, you'll find there's a zinc electrode and there's a lead electrode, and the electrons move from one to the other, and that flow of electrons is the current which powers the battery. So if your battery runs out of water, then there's no salt solution, then it doesn't work. And eventually the amount of zinc that's in the battery runs down, and there's no more electrons to go to the lead, and so the battery stops working. But if you take an amalgam filling, like a silver filling, so now you have about 50% of its mercury. That's one metal. And then it's also got silver, tin, and copper that are added to it to make the amalgam. So now you have mixed metals in the saliva, which is a salt solution, and they can generate an electrical current. Same with the gold crowns. Gold crowns are an amalgam. They're a mixture. Gold is way too soft to put in the mouth. So there's a mixture of 4, 5, 6 other materials that are mixed in with the gold, and they're mixed metals in a salt solution. So what I routinely do with people, in part of my physical exam, I have them open up their mouth. Okay, you've got mercury fillings or you've got gold amalgams. I bought a voltmeter from Radio Shack for $28. I put the setting on millivolts. I put one electrode on the tooth with the filling, and I put the other one on the cheek just to see, is there current flow? And in many cases, there's high current flow. A normal nerve fires at about 70 millivolts. So if I see teeth that are way, way more than that, I know that electrical energy is going into their jawbone, into the nerves, into their brain, into their body 24 hours a day, 7 days a week, for years and years and years. And this is like electrical noisy stress. Now, why do some people have anxiety, or they can't sleep, or they have headaches? Well, it may be contributed to by these current flows. And I've seen them where they're 200, 300, 350. And the most dramatic case I ever saw was a woman who was a very successful business owner in the area where we work, and she came in. Her chief complaint was that she'd had headaches for 25 years, and her solution to the headaches was that she would take 20 to 25 Tylenol a day because otherwise she couldn't get through the day. And she wanted to know if there was anything that could be causing this in her body. She had been to a neurologist. She'd had an MRI of her brain and her neck, and she'd seen her internist, and nobody could find anything. And when she walked in my office, she had quite a few fillings. I put my meter on her, and one of the fillings was putting out 350 millivolts of electrical current all the time, day and night. So 350 is a lot more than 70. I knew this was going into her head. I sent her over to the dentist. I said, this is the worst tooth. Take this one out first. So he drilled out the amalgam. He's a natural biological dentist. He drilled out that amalgam, and she said by the time she got from the operatory to the front desk to pay, the pressure in her head that she'd been fighting for 25 years was gone. And that really taught me a lot about, holy cow, these things are active and they're not supposed to be there, and depending on the person, they can cause them a lot of trouble.
Dr. Minkoff, I'm sure you would agree, but just another little thing which I hope doesn't feel like it's way out in left field to bring up, but for all you people out there using cell phones with mercury-based silver fillings and all these other metals that you talked about, Dr. Minkoff, you know, we cannot forget that we are truly electrical beings. Our nervous system, our heart, how it's deeply, intimately connected to the way we mentally are, how we feel emotionally. It is so all connected. And to have that cell phone so close to the head with all of these metals in the body, being mercury toxic, aluminum in the body, talk about an electrical charge that could really be nasty on our physiology, no?
100%. And you know, usually when it's in the mouth, just from the teeth exposure, but also from, you know, if you eat a lot of tuna fish and you get a lot of mercury that way, or if you had a lot of vaccines, or you live near a volcano, these are the things that put mercury in the environment and get them into our bodies. Those metal particles are in our cells. And when you're in an environment where you're close to alternating current, where 120 times per second, you have an on-off of electrical current, those metal ions are vibrating with every one. And some people are very sensitive to this, and they can really be affected by it. And they're metal toxic.
Dr. Minkoff, let's go back for something which I think is important in case people are just really tuning into just our conversation, because it really is that important. The connection between root canal treated teeth and heart attacks. Can you kind of go over that just a little bit more for a few minutes?
Yeah. I mean, I think that the toxins leak into the jawbone, and then they affect the nerves, the autonomic nervous system, and the toxins probably also get in the bloodstream, and they can cause clots and other things elsewhere. These are endotoxins. They're very potent, and they cause disturbance in the body. And so, you know, the thing that's wrong with virtually every the epidemics that we're seeing now that have never been in history before, with cancer and heart disease and autoimmune disease, are based on environmental toxicity. If you have a thermometer in your office and you drop it on the floor and the thermometer breaks, you have to call the hazmat guys to come in and do the cleanup because it's an extreme biohazard. So they come in with suits and masks and the whole thing, and they clean up the area. And then what they do before they leave is they have a meter. It's a mercury vapor meter. And they test the area to make sure that the mercury vapor meter is below 1 microgram per cubic centimeter of air. That is the standard for the EPA on safe environment. Now, I bought one of these mercury vapor meters, and it's the same one that the EPA uses. And I measure people's mouths. I have them open their mouth and stick the mercury vapor meter in their mouth when they have amalgam fillings, and they might have 10, 20, 200 micrograms of mercury coming off their teeth all hours of the day. If the EPA were there, they would claim, they would say that their mouth is a toxic waste dump and they couldn't open it or breathe in a public area. It's that crazy. And this is measurable. It's like easily measurable. And it's there. So you can ignore it if you want to, but over time, this will get to you probably, unless you have extraordinary genetics. And it's easy enough to get them removed safely by someone who knows how to do it, and then they're not in your mouth anymore, and it contributes to your health.
No, but the bottom line is I want people to appreciate the fact that a heart attack, right, is not just like the arteries are getting clogged, over time, more and more. Yes, it can happen this way, and then eventually the artery gets so closed off, the person experiences a heart attack. Really what it is most of the time is this plaque buildup. Now, the question that should be asked is, what is creating all this plaque buildup? And then most of the time, the vast majority of the times, with the circulation going, the plaque tears away abruptly and closes off an artery, and then wham, the person experiences a massive heart attack. That could be the first time ever they had symptoms, and that could be when they die. But I'm going back to the point of, isn't it quite possible that the toxins in our mouth, root canal treated teeth, even for that matter, the mercury that's leaking year after year after year is spilling all of these toxins into our bloodstream and certainly around the heart? That what I've heard from so many professionals, and it makes so much sense, Dr. Minkoff, I just want to get your feedback, is that this plaque is really trying to help us. It's like going in to try to repair these arteries that are getting injured over and over again from all these toxins that are circulating in our body, that the plaque is just there to try to sort of patch up these areas that are getting injured. What do you think?
I think you're right on all counts. I mean, the things that cause the inflammation in the endothelium, which is the inner lining of these blood vessels, is heavy metals like mercury and lead and arsenic and cadmium, and bacteria from the gut or from teeth or from root canals. That those are the inflammatory particles which get lodged in the endothelium. They cause an inflammatory response, and cholesterol is just part of the body's mechanism, Band-Aid, to try to cover it up and help it. You're totally right. And this isn't an accident. Half the people, their first diagnosis of heart disease is because they died because they had a heart attack. It can be very subtle, but it's there, and the antecedents, the things that come before, often are related to pathology in the mouth.
Dr. Minkoff, so well said. And I've told people over and over again throughout this event and all the programs I've created, please do everything you can right now. It's so worth the effort to get away from toxins. Get yourself away from these really close threats. And just doing that alone, your immune system calms down, and then it can go seek out these really deep-seated issues, if you will, attack them, take care of it, and keep us safe from harm. That's what it's all about, instead of always being on such high alert until one day we get so worn out that that's when these horrible symptoms come up and we experience so many health problems. So like whether it's a root canal treated tooth or the mercury-based silver fillings, Dr. Minkoff, we've touched on it a little bit, but for those people out there concerned about autoimmune disease, they're concerned about cancer. My goodness, Dr. Minkoff, even people out there suffering with brain fog issues or energy level problems, isn't it true that all of these toxins that we've been talking about are a direct way of assaulting our immune function and can literally suppress its ability to function at a high level? Isn't that fair to say?
It's totally fair to say. And then what happens is that it's not just the immune system, but the whole clearance, the detoxification system gets so overloaded that it then can't clear the ongoing toxins that are coming in from inside the body and outside the body, and you just get higher and higher levels to where these toxins go deeper and deeper into the cellular structure, and then you get cells that don't function, they can't make energy, the DNA becomes toxic, and then virtually the thing is that every person with a chronic illness, if you're out there seeing a doctor for an autoimmune illness, or you have cancer, or you have chronic fatigue, or you have chronic Lyme disease, all of these conditions, your body is toxic. And if you have root canal teeth in your mouth, there is a high likelihood that unless you get those out, or at least see a very competent biological dentist who can test them, that they are a big part of the problem, and that if you want to get better, you sort of have to just deal with it. Get them handled, get them out.
Well said. I mean, there it is right there, too. Dr. Minkoff, we hear so much more than we really should. We should be getting at the root of what's causing inflammation. But that's my point I was just about to say is we are hearing all the time, inflammation's the problem, over and over again. But dental toxins are a huge source of the problem here in terms of causing the inflammation that is hampering our digestive system. It's not able to work well. Then we've got issues with our energy going down. Our digestion is obviously directly connected to our ability to absorb nutrients from the food that we eat, whether it's a good or a bad system that we have. And then all of this put together is what's really killing our immune function. So as we close out, Dr. Minkoff, again, we started with this, but I think it's important to finish with it. We're talking about, I don't know, I'm guessing, but it's an educated guess, probably over 100 million people dealing with this on some level or another, mercury-based silver fillings, and how it impacts our health. Please kind of go over this now a little bit more. Everybody coming into your office, all the complaints they have, and like you say, the connections that you see with these people complaining and what things look like inside their mouth. Talk to us about these mercury-based silver fillings.
Okay, if I could just digress for a second, I just saw somebody which kind of just makes the point. She was a person that had a blockage in her nose, and she went to the ear, nose, and throat surgeon who looked in her nose and found a polyp that they were suspecting was tumorous. He took her to the operating room. He took out the polyp in her sinus, and it turned out that the polyp was cancer, but he felt that he got most of it out. But now what they wanted to do was do radiation treatments on her sinus. And she came into me because she was a little distressed about this. And when I had her go over to the dentist to do the cone beam CT, what we saw was that there was a root canal tooth in the upper jaw right underneath that sinus where the dentist had actually made a mistake in doing the root canal. They put a post, a metal post in the tooth to secure it so that it doesn't break, because they hollow out the tooth and it would be fragile. So they put this post in there and they put some cement in there to try to hold the whole thing together. And the dentist had put the post in too far, and it was actually sticking in her sinus. The post was through the root of the tooth into the sinus. There was a chronic swollen mass around the edge of it because the body was trying to deal with this piece of metal sticking in the sinus, and right next to it had been the tumor. And the ear, nose, and throat guy had taken out the tumor. He did a good job on that, but he didn't even look at the teeth or probably what was the cause of this cancer. So I think people have to sort of take their own health into your own hands. If your doctor is not getting you better and you're doing prescription after prescription of more and more things to try to deal with your symptoms, there's a very high chance that that's the wrong target, that you have underlying conditions, and it might be mercury in your mouth, it might be root canals or gum infections pertinent to this summit that are the underlying cause of what's wrong with you. And you have to find doctors and dentists who understand this information and know this information, who can help you to get better. Because once you find what the real thing is, you can get better and you don't have to suffer.
Dr. Minkoff, I want to thank you so much for your time And I want to thank our listeners for joining us today. If you would like a copy of this program, plus all the other presentations inside the Holistic Oral Health Summit, simply click the banner you see on this page. Thanks again for attending the Holistic Oral Health Summit. Talk to you soon. Take care.